Hello, and welcome to our presentation on the disorder of binge eating. My name is Kayla Adams, and I have role A. So I will be giving you a quick but concise and informative overview on the disorder of binge eating. So let's go ahead and jump right in. Binge eating disorder is characterized by eating large quantities of food in one sitting. And this is usually done very quickly and to the point of just being uncomfortable or painfully full. So you're just eating until the food is gone, and at that point you're very uncomfortable and feeling very full. This is not to be confused though with the eating that we do during holiday celebrations. So, for example, many of us tend to overeat during the holidays, right? Holidays like Christmas, Thanksgiving, those types of holidays, we tend to overeat and eat a lot, and sometimes in a small amount of time. So this would not be considered part of binge eating disorder. So if you do partake in lots of eating during holidays or cultural celebrations, that does not necessarily mean that you have a binge eating disorder. This is the most common eating disorder seen in the United States. They are, and this is within the family of many eating disorders, so anorexia, and bulimia, and those kind of disorders. This one is the most common that we're seeing people present with. So let's get into specifics of a binge eating disorder. So what you really want to look for in terms of, okay, does this person have a binge eating disorder, are a couple of things. So you want to make sure that they have the following, which is they have a reoccurring episode of binge eating at least once per week for 3 months. So they are continuing to eat lots of food, and it's occurring at least once a week per that 3 months. An episode would be in a small amount of time, someone's eating large portions, and this would be more than most would eat within that same period of time. So for example, if you sit down and within an hour to 2 hours, you eat, 4 Big Macs and 2 orders of fries and 2 more hamburgers, then that would be considered an episode of binge eating. This would also include excessive food consumption is accompanied by a sense of lack of control. So this meaning that once you started eating, it's very, very difficult for you to stop eating. There may be other distractions that come up. Say your phone starts ringing or something like that, but you're really not able to stop eating to answer your phone. There are exceptions to that, and that's usually when someone that like if your mom walked in on you eating a ton of food, then you would quickly try to stop and hide what you're doing. Which actually brings us to the next criteria, which is people with binge eating disorder are usually pretty ashamed of their eating problem. So people with the disorder really don't want people to know how they're eating, don't know that this is happening, and that really keeps this under wraps in terms of people close to you knowing. So a lot of this may look like they are hiding, wrappers of food from you, or any other evidence of the type of food they're eating. They may be eating alone. Say someone is best alone in their car, so they'll just binge eat within their car. Or they'll lie about what they've eaten and where they've eaten it. So they, if someone asks them, okay, when was your last meal? They may lie and say, oh, I haven't eaten, or anything like that, or I didn't eat that much. So definitely a signifier in terms of people feel very ashamed of their eating problems. A few more specifics. There has to be a marked distress, and 3 of the following must be present for diagnosis. And when we say marked distress, it means, there's distress around the fact that when you're eating too much and you're feeling ashamed of it, and it's getting in the way of your life and making you very unhappy and all that. So there's marked distress. And then on top of that, there's the issue that you're eating more rapidly than normal. You're eating very quickly, and you're just, shoving it in your face really quickly and really having a hard time slowing down on eating. You are also eating until you're painfully full. So like I said before, you're just eating and eating, and not paying attention to the fact that you're probably full already. So by the end of the meal, you're just really uncomfortable and feeling painful. You'll also eat lots of food even when you're not hungry. So you may just see food and just like, I have to eat it. Regardless of whether you had a meal already, you're still going to want to eat the food. And then keep eating, as I said, until you're full. As I stated before too, you're going to want to eat alone. You're ashamed of this, and you're really going to make sure no one sees what you're eating. And so people with this disorder do tend to eat their food alone. And feeling disgusted with oneself, sad, guilt, depression, shame over their binge eating. A lot of people will finish a meal, and right after, they just are flooded with this feeling of shame and unhappiness about the fact that they just finished this much food, what it means for them health-wise, how they're feeling. So three of these have to be present for this diagnosis. So whichever three is present, that can still present as binge eating disorder. Prevalence. So little really is known about how people develop this disorder. It's kind of hard to figure out, what are the causes of this disorder. There are a number of reasons people are trying to figure out, but thus far, little is known. Binge eating. People, though, who are obese do have a higher risk of developing this disorder. So if you're already obese or dealing with being overweight, you do have a higher chance of getting these. However, binge eating is still found in both those who are obese and those who are considered normal weight. So when we say normal weight, it's people who maybe on a medical index are within the weight range they should be for their height, age, and whatever else they use in terms of that scale. So really you can be fine either, even though the instances are higher with people that are overweight and obese. Normal weighted people can also present with this disorder. It is more prevalent among women than men. So like many of the other eating disorders, we do find that this happens with women more than men, as well as the fact that it is really common in adolescents and college age populations. Binge eating does seem to run in families, so they are seeing that people whose parents, grandparents, siblings, cousins have binge eating disorder tend to also have it. So there's a lot to discover in terms of what does the genetic makeup look in terms of, binge eating, and where are the genetic markers for this being more susceptible for certain people through family lines. Binge eating is associated with other psychiatric diagnoses as well. And this, could be anything from bipolar disorder, anxiety disorders, and substance abuse disorders. There's a comorbidity with other disorders, and for a number of reasons. But if you can only imagine how, anxiety increases your need to binge eat, or your binge eating creates anxiety, or, binge eating creates a substance abuse disorder because you're depressed, or being bipolar and having those ups and downs create a perfect kind of situation for binge eating. So that's definitely a comorbidity that you have to consider in terms of, okay, this person is binge eating, or is that grouped with any other psychiatric diagnosis that I need to consider when treating this patient. So this video that I'm going to have you watch is actually a really good representation of, one, binge eating as a disorder. So attributes that are seen within people who binge eat, their feelings, a lot of what I discussed above. But it also gives a face and an experience to the diagnosis of binge eating. So a lot of us are reading about it in our DSM and just thinking, oh, it's binge eating. And and that's what it is. It's kind of cold. But once you see somebody who's literally struggling with this diagnosis, the history that kind of led to this diagnosis and this issue, and kind of the toll it takes on someone's personal life, professional life, and overall just self-perception of oneself. This is a really good depiction of that. So I hope you enjoy this video and you gained a lot of knowledge in terms of what is binge eating disorder and what does it look like in everyday people that we can see on the street.